My name is Dr. Chen. I'm the medical director for Ballard Rehabilitation Hospital, and I've been asked today to talk about something called Cauda Equina Syndrome. Cauda equina is actually a Latin word. It means horse's tail, and it refers to this part of the anatomy of the spine. As we age, the spinal cord stops increasing in length. So after about the L2 level, it is a bunch of nerves that exit the spinal cord and actually looks literally like a horse's tail. So if you do surgery or if you have an anatomy class, that's what this area of the body looks like. In our patients, the symptoms that usually develop in this type of syndrome are progressive weakness that can progress to all the way to complete paralysis, and they can also lose control of their bowel and bladder as well. The Caudaequinic Syndrome can result from traumatic means like a car accident or a gunshot wound, or it can also result from non-traumatic means. So if you have degenerative spinal arthritis with herniated discs, or if you have a tumor, but anything that compresses this area of the nerves can result in that Cauda Equina Syndrome. And again, progressive weakness in your legs, loss of bowel and bladder function, and even what we call neuropathic pain symptoms, burning, tingling, or numbness in the lower extremities. So the treatment, of course, is to find out what is causing compression there. With bleeding or trauma, you need to, of course, take care of the trauma. With arthritic problems or with tumors, surgery is done to remove the pressure on the spine. And then afterwards, they, of course, will need aggressive rehabilitation to treat the bowel and bladder dysfunction, the weakness and loss of function and mobility because of the injury to the nerves. There are different things to take into consideration because compression of the actual spinal cord will result in spasticity, increased muscle tone, abnormal movements, whereas compression of the Cauda equina part of the spine results in the opposite problem. There's still weakness, but there can be loss of muscle tone and actually loss of reflexes. So finding a facility that is familiar with this type of syndrome and knows how to treat it specifically is extremely important, and that's what we do here at Ballard.